to another episode of the Prescription for Better Living podcast, where we discuss all things health and wellness in a hip and relatable way. As always, I'm Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire. And welcome to episode 40 of the Prescription for Better Living podcast. So, if the Prescription for Better Living podcast has helped you, blessed you in some way, taught you something new, gave you a new perspective on anything that we've discussed, here's what I need you to do. I need you to like the podcast. I need you to share. I need you to comment. I need you to spread this good news everywhere you go in all your circles. Hallelujah, Dr. Carter is here. If you would like to support the Prescription for Better Living podcast, we welcome your support. And there are several ways you can do so. You can hit us on the Cash App, $PBL podcast. Again, no amount is too large or too small. You can become a member of our community on Patreon, patreon.com/Dr. Hernando Carter. Just $1 a month supports us. If you would like to sponsor an episode or sponsor the podcast, you can hit us up, contact@rxforbetterliving.org. You see it there on the screen, or you can DM me on the socials and we'll get back with you. Speaking of sponsors, shout out to my man Cedric Cooper and Right on Time Physical Therapy. You know what I'm going to say about physical therapy? If you got something hurting, no matter what it is, holler at Right on Time PT, Cedric Cooper. If you need to work on your balance, work on your mobility, work on flexibility, holler at Right on Time PT with Cedric Cooper. Also, I had a conversation with my man Cedric Cooper, and he's got something new coming for y'all. Look, maybe you need a specific exercise plan. You want your own exercise plan that is designed just for you to help you meet your goals. Well, physical therapists are experts at doing that. They get their doctorate in all things physical therapy, all things having to do with your body and your joints and your muscles. So hit up Right on Time PT, my man Cedric Cooper, right over there off Avenue D in Ensley at the Ensley Health Club. You see the number, you see the address, website, rightontimept.com. Give them a holler. Also, another sponsor we have, Bespoke Wellness Services. Yes, Lord, Bespoke Wellness Services. Look, whatever you need, we got you. You need help with weight loss, Bespoke Wellness Services, we got you. You've been working out, you've been running, you've been lifting, you having some muscle cramps, you're sore, you're dehydrated. We got your IV infusion therapy at Bespoke Wellness Services. Some of you may be looking for a primary care doctor. We can't take on the whole city of Birmingham and state of Alabama, but we got you for the concierge primary care. Just hit us up. You can hit us up at 205-396-2820. You can email us at care@bespokewellnessservices.com. Hit us up, website, bespokewellnessservices.com. That'll take you to drhernandocarter.com, and you can book a free consultation. Listen, also, hey, drhernandocarter.com is a sponsor. I know you want some of our podcast merch. You've seen people walking around the city sporting our Living Better sweatshirts, and we got more merch coming. Look, drhernandocarter.com. Just click on shop and it'll take you right to our online store. If you are interested again in being a sponsor, hit us up because we got a following, we have a community, and we'll be more than happy to accept your support while we promote your business. Now, my pleasure. You know where we started talking about that heavenly chicken place. And I'm just all giddy because I'm back in the studio with my man Gary. Gary's over there, he said that, man, if you keep mentioning me, they're gonna demand an appearance. And I think that's coming in the future. I can foresee that coming. But me and Gary, a couple episodes ago, were rapping about this heavenly chicken place, and we were using it as an example of what great customer service looks like. That was episode 38, so go check it out. I think you'll enjoy it. Last episode 39, we really tried to lay out in terms of the medical industrial complex what that looks like when you start trying to apply good customer service principles to the medical industrial complex. We also said that, hey, whether we in the medical industrial complex realize it or not, patients, you are customers. We are delivering you a service, and you in return are paying us for that service, whether it be us billing your insurance, your deductibles, your copay, what have you, right? There is an exchange of revenue for services rendered. That makes you a customer. And the reason we said that it's important for those of us in the medical industrial complex, doctors, dentists, nurses, nurse practitioners, physician assistants, physical therapists, whatever, healthcare related, even healthcare administrators, the reason it's important for us to acknowledge that fact is because when you don't acknowledge that fact, it creates an environment that is ripe for poor patient experience. Poor patient experience is bad because it causes you, the patient, to have negative feelings, thoughts, emotions about receiving health care. It can cause mistrust. It can lead to poor outcomes because there's a communication breakdown. There's a breakdown in trust. You don't trust the recommendations that the doctor makes. And I don't know if you've noticed it or not, but we have a problem with there being a lack of trust of the medical industrial complex in our country. It was always there beneath the surface, but the pandemic unearthed a lot of bad stuff. And unfortunately, post-pandemic, that trend is continuing. Where are you going with this, Hernando? I'm glad you asked. I care about all communities. I do. But my passion is for my community because we have been so underrepresented, so undervalued, so marginalized as it relates to healthcare in this country that all of the healthcare outcomes are worse in my community. I asked the question dozens of episodes ago, is it just bad luck to be Black in this country? And the answer is, of course not. But there are health disparities. There is health inequity. And the atmosphere of mistrust that exists in this country, while it may give other communities in this country a cold, it gives our community the flu, the pneumonia, respiratory failure, and death. So I'm on a mission to attack whatever sources of distrust, of false information, of disparity and inequity. So that is what this series is about. Because studies show that if people like their healthcare provider, if they trust them, they will communicate better and their outcomes will be better. So, we talked about last week what a bad doctor's visit looks like. And then we started talking about what a good doctor's visit looked like. So this week in episode 40, I'm going to give you the diagnosis. All right. This is my pleasure. The diagnosis. The diagnosis of what, Hernando? I'm glad you asked. The diagnosis of what is wrong in the medical industrial complex. What is at the root of all of these negative experiences that people have at the doctor? And some of you may understand some of those reasons, but I still think it's worth stating, because sometimes you can think something is so obvious and you fail to state the obvious that it goes unsaid, it goes unrecognized, it goes without acknowledgement, and then it becomes a mystery. So, why is it that you have such a negative experience at some of these doctors' offices? Why are the wait times so long in the waiting room, in the exam room? Why is it that everybody seems so stressed out, uptight, on edge? Nobody's smiling at you like they should. They ain't smiling at you like you came in there to spend money to support their job so they can pay their bills, send their kids to school, go on vacation. Because, hey, if you stop showing up, guess what? They got to close down shop, baby. Lack of responsiveness, poor communication. Oh, my God. Bad bedside manner. What is that about? Well, let's get into it. So I don't know if you remember, this was about, Gary, I would say 39 episodes ago, 39 weeks ago, in episode 1, numero uno, I started out by talking to you about a health care crisis in our country. We talked about a shortage of primary care providers, but we also talked about the doctor shortage that is here. It's not looming, it is here. We talked about how the admission rates to medical school have over the decades remained relatively flat compared to the population, which means that the number of doctors that are graduated year over year has remained relatively flat, but that our population has continued to increase, contributes to the doctor shortage. Also with the doctor shortage, the baby boomers started retiring in all kinds of industries en masse, especially with the pandemic. Individuals who would have worked another 5 or 10 years cashed it in. That contributed to the doctor shortage. Well, there's not just a doctor shortage. There's a shortage in pretty much any role that touches patients in the medical industrial complex or our healthcare system. There's a shortage of nurses. There's a shortage of nursing assistants and medical assistants. You can't hire enough. They're hard to find. Staffing levels aren't good. And so our healthcare system is overwhelmed, y'all. It's overwhelmed. There are hospitals all around this country shutting down. In our state, there are hospitals shutting down. We just had a hospital in Montgomery, Alabama, Jackson Hospital, who filed bankruptcy. Now they're still open and they are reorganizing, but right here in Birmingham, y'all, Caraway Hospital. I don't know if you remember Caraway. I was there working when they shut down. I was chief resident. I was on call the night before, and we were admitting patients to the hospital and to the ICU, et cetera. And they came in the next morning and said, we shutting down. And do you know how long it takes to shutter the doors of a hospital once you start closing it down? I know because I was there. It takes about 7 days. That's all. To get hundreds of patients transferred out of the hospital, to shut down the ICU, to shut down the emergency room, about 7 days. Well, we have hospitals closing all over. Our healthcare system is overwhelmed. We talked about the physician shortage. There are more patients than there are physicians to take care of them. Well, what does that lead to, Hernando? I'm glad you asked. It leads to a mismatch. One primary care doctor can have 2,000, 3,000, 4,000, 5,000 plus patients. One person. How can you take care of all of those patients? Overwhelmed. One primary care doctor seeing 20, 30, 40 patients a day. And then they don't have the staff available to help move those patients through the visit in a timely fashion. You have tight margins in healthcare. Margin is a business word, but let us not be misled into thinking that healthcare is not a business. You have tight margins. The cost of delivering healthcare has continued to rise year after year after year, whereas the amount of reimbursement that providers and hospitals and clinics are reimbursed by the insurance companies have stayed relatively flat. So what that means is that there's less money to go around. You have to pay staff. Wages are going up. You got to provide insurance. Y'all know that's through the roof. All of the kind of benefits. You got to keep the lights on. What else is up? Rent, water, power. That's called overhead. And so you have tighter margins, which means that the providers have to see more patients per day just to keep the lights on. Why is everybody always frowning? Burnout. Y'all ever heard of burnout? Where you can have a job that you dreamed about, that you love, but then you wake up in the morning and you hate going now. Like the thought of going just makes you sick at your stomach, or you get anxious or depressed, or you have panic attack. That's called burnout. I was there at one point. I was working at a really busy practice, and I had more patients than I can handle. And I just felt like I was on a treadmill every day when I hit the door, running in place and not going nowhere. Overwhelmed. Patients couldn't get to me. Appointments booked out 6 and 12 months. Not able to deliver the kind of care that I want to deliver. Not able to take the kind of time that I want to take with my patients. And for me, it did not turn into poor bedside manner, no. But it took some of the joy out. I would lock up in my office and have panic attacks. Now, I told you I wanted to be a doctor since I was 4 years old. That's all I dreamed about. I'm living my dream, y'all. But I was going to work having panic attacks. Because healthcare providers get so busy and so overwhelmed that we feel like we're drowning. So that's why they walk in the room and they seem hurried and rushed, because they start out their day behind. I mean, think if you worked at a factory, right? And your job was to, I don't know, let's just say build blocks, right? And you had a quota every day to build 500 blocks a day. That's what you thought your quota was. And it seemed very reasonable for you to be able to meet that quota. You did the math and said, hey, I can easily do about 60 blocks an hour for my 8-hour shift, and I can make my quota. Well, what if you walked in one day and your quota suddenly changed? And it's not 500 blocks per day, but now it's 700, 800, 1,000. But nothing else about your job has changed. You didn't get any more resources to do that. They didn't buy some new fancy equipment or a faster conveyor belt, or they didn't hire more people to come and help you push this doubled quota through. They just said, no, it's just, this is the work. Just get it done and do a good job. Don't make no mistakes. Don't kill nobody. Make sure everybody happy. And what happens is, because believe it or not, most people who go into healthcare, doctors, nurses, nurse practitioners, physician assistants, dentists, pharmacists, they go into it because they really do want to help people. The majority do. There are always exceptions. But if you're one of these people that go in and you really want to help people, but the goal line keeps moving, your quota keeps changing, you can't deliver the care that you want to deliver, that's tiring. That's mentally and emotionally exhausting. That's burnout, y'all. Did you know that there are more doctors leaving the workforce now, and fewer people are going to medical school now? Yeah. Did you know that the rate of suicide is up in doctors? Yeah. Look up Laura Breen's Heroes. It's a foundation that focuses on trying to make it easier for healthcare professionals to receive help for mental health challenges like depression, anxiety, substance use disorder. Because it used to be, if you filled out the paperwork to renew your license and you reported that you had depression or anxiety, you had to go for evaluation, for treatment. Your license could be suspended. It could be restricted. And so doctors were not reporting and getting more and more depressed and killing themselves. Alcohol abuse is up in healthcare providers. Prescription drug use is up in healthcare providers. Illicit drug use is up in healthcare providers. They trying to cope, y'all. A lot of times, they're not innately an asshole. They burned out. They burned out. So, this is just a little bit scratching the surface on diagnosing this problem. As a primary care doctor, once I diagnose a problem, then I recommend a course of action, a treatment. And if you want to hear what that is, well, you're just going to have to come back next time. Because this has been another episode of the Prescription for Better Living podcast. Yes, I am Dr. Hernando Carter, board certified internal medicine physician and no longer burned out with my job. Your primary care extraordinaire, saying, wherever you go, whatever you do, share this good news and stand on the tallest mountaintop you can and scream to the top of your lungs, hallelujah, Dr. Carter is here. Until next time, Dr. Carter saying, peace out.